I think all of you have covered, as Dr. Matlesh told me, about how to set up a oral pathology lab. And this is a wonderful opportunity for all of you to learn and understand that, setting up a lab, then getting it accredited by NABL, why it is important and how to go about it. So I will be talking about a little bit overview about what is NABL and why it is important for you, and a few steps about how to go about it. So I'm Dr. Jatinder Bhatia. I am Director with 360 Diagnostics and Health Services. We are doing NABL, or you can say quality management system trainings all across India. And quality is my passion. And this is about me, though on the first day of inauguration, I was introduced. So I have 30 years of experience in diagnostic industry, worked with various corporate groups and in the country and outside the country as well. And along with, I'm a lead assessor with NABL, and I'm an assessor with NABH and blood banks. I'm a member with Healthcare Committee FICCI, Quality Kaho, honored with Sadbhavna Award, Bharat Jyoti Award, and 101 Global Healthcare Leaders Award. So this is about the global perspective of the accreditation, that why we say accreditation is important and how you can be globally connected and you can be globally at par with all other laboratories once you are accredited by NABL. And when we say NABL, it's basically ISO 15189-2012. So you all have to remember that ISO 15189-2012 is the terminology which is used all across the world. If you will go in another country and you will say we are NABL accredited, might be they will not understand. But if you say ISO 15189-2012, then whether it is America or it is Japan or it is Australia, everybody, all the clinical laboratories are accredited by this particular international standard. So why quality is important? Basically, this standard is what? This standard is to ensure that you maintain the quality in your laboratory and you give the best results to your patients, looking at the pre-analytical, analytical, and post-analytical processes. So what is quality? It is the degree to which a set of inherent characteristics fulfill the requirement of standard guidelines to achieve customer satisfaction. See, ultimately, what is the goal? The goal is customer satisfaction. Customer should get what he desires or what he deserves. So for doing that, we have a set of standards which we should follow. So these set of standards are what? They have come from the ISO. So ISO gives us those set of standards which we need to follow, and we have to ensure that customer is satisfied. Now, to what extent that quality is being followed measures the degree of quality. And in healthcare, you can very well imagine that quality has to be 100%. We cannot say that 99% quality and we can miss on to 1%. 1% is a very big number for missing the quality or for doing errors in a laboratory. So why is it important? Because clients, users expect quality. Poor quality means rework, which is additional cost. Poor quality results in problems that can be difficult to diagnose and solve. Poor quality can cost lives. So in healthcare, quality cannot be compromised, right? So this is very important to understand. And how we can maintain that quality? We have to follow standards. Specifically for the clinical laboratory, standard is ISO 15189 2012. Why we call it 2012? Because this standard came into being in 2003. 2003 was the first version of the standard. After that, second version was 2007 and third version came in 2012. So currently in 2020 also we are still following the third version. Any day or maybe in 21-22 we are expecting the next version to come. Okay, so 2012 is the version and 15189 is the standard. And you can see, it's not a very old standard. It came into being only in 2003. So 17 years back, we actually invented, what kind of a standard or what kind of quality protocols are required to be followed to say that this lab is a quality lab. Now, it's very important to understand certain terminologies. You must have heard that so-and-so industry or so-and-so organization is ISO certified, right? Then why do we say certification or accreditation are different? There is a major difference in the two things. When we say certification means that we are only bothered about the management part of an organization. So what does it mean? It means that even if it is a IT industry or it is a shop or it is a spare part workshop, anything can be ISO certified. Means they just follow this thing, that how they have to purchase things, how they have to maintain things, how they have to look at the customer satisfaction, how the complaints have to be handled, how audits have to be done. So it is all related to management and it does not have any technical competence part into it. So certification means it is ISO 9001, not having any specific technical requirement, right? So any industry can be ISO 9001 certified. Whereas when we say accreditation, accreditation has two major components, management, and the second component is what? The technical competence. So when we say accreditation, that means we are ensuring that the reporting part of the laboratory is also assessed and the technical competence of the people working in the lab, whether they are technicians or they are doctors or they are signing authorities, they should also be audited, right? So if we go by definition, this is a procedure by which an authoritative body like NABL, in our country we call it NABL. NABL means National Accreditation Board of Laboratories. Okay, so this is an Indian name given to a body who is doing assessment for ISO 15189 and certain other standards as well. So this gives a formal recognition that a body, which means laboratory, or a person, means the signatory, is competent to carry out specific tasks. That means scope. So scope means the tests for which you have applied for. For example, if it is an oral pathology laboratory and it is doing oral histopathology, so your scope of accreditation becomes oral histopathology. If it is a complete histopath lab, which has all other parameters or all other organs also included, so it will be a complete histopathology department and it can further have a detailing that what all modalities you want to get accredited. So it can be biochemistry, it can be hematology lab, it can be clinical pathology lab. So like that, the lab has been divided into basically 8 types of scopes. Okay, so all of you, understand that these 8 specialities in the lab can be hematology, which I'll talk about, and I'll tell you also what are those 8 specialities under which the scope has to be given. But for you, it is primarily the oral pathology which is important. So NABL is a body which gives accreditation to a lab, to the person who are signing, and the scope. So it's very specific. So when anybody says that my lab is NABL accredited, so it's not the complete lab. It means the lab is accredited for a particular scope, for a particular test. You might be doing 100 tests and your lab is accredited for only 50 tests. So this you need to understand when you say that I have to get my lab NABL accredited. You should be very clear what are the parameters you want to get accredited. So in the accreditation, the major step in the accreditation is audit. So audit can be audit by the lab seniors initially, and then audit by the external body like NABL. So what is audit and how you have to sort of prepare for that audit? If we go by definition, it's a systematic, independent, documented process for obtaining audit evidence and evaluating it objectively to determine the extent to which audit criteria are fulfilled. So what does it mean? Systematic means it's not that randomly someday NABL will come and they will have a check on you. It is a planned kind of a audit. So accreditation audit is a planned audit. Independent means unbiased. So NABL is a third party. So they don't belong to or they are not connected to your laboratory somehow. And documented process. So any audit where documentation is not done, it is as good as not done. So it has to be a written process. Everything has to be documented. And what exactly they do is that there is a set of standards or there is an audit criteria and they just come and see whether you're following it or not following it. And if you are following it, to what extent are you following it? Okay. So that measures your level of quality. So when we say audit, now you must have learnt about the term internal audit. Means the lab belongs to a user and you yourself, you audit time to time your laboratory. Second party, your users are auditing the lab. If some doctor is referring you a test or some doctor has sent a sample for histopathology to your lab, he also has a right to come and audit your laboratory, which we call as second party audit. And when it is a third party audit, means independent body who's not a user, not a provider, but is independent, unbiased body who comes and audits you. When you have to apply for NABL, there is a criteria, whether you are a small laboratory or you are a medium laboratory or you are a large laboratory, which will depend upon the number of patients you are receiving per day. Up to 100, it's small. Up to 400, it is medium, and more than 400 is a large laboratory. So you have to, why it is important is because the fees of NABL will depend upon the size of the laboratory. So this NABL is a national accreditation body. This is established by Act of Parliament, user or government funded, not-for-profit organization, third-party accreditation body, and it is connected through MRAs to other countries. So when we say MRA, so MRA means, I'll just show you one slide. Okay, we'll go to it little later. When we say MRA means Mutual Recognition Agreement. What does it mean? Supposing somebody has gotten it tested in your laboratory and your laboratory is accredited by ISO 15189. Now, if patient goes to another country and he says that this is my report and my lab is NABL accredited, so that country accepts that report. Because if it is 15189 standardized, the acceptance all over is like this, that NABL has signed agreements with other countries that if a report comes from NABL lab, other NABL labs or other countries' labs will accept it. So that's a very big advantage. So if we go by the functions, so what the functions accreditation body does it, that NABL is to maintain a uniformity within our country. Okay. So if there are set of standards and every accredited lab is following those set of standards, that means there would be uniformity. Okay, the systems would be similar. And second thing is that they themselves also have to maintain a good practice accreditation. The accreditation body is also accredited to keep themselves in connection or in parallel to the other labs internationally. Right? So it's like a linkage that you are accredited, your accreditation body is also accredited, and then it is a part of a international laboratory corporation. These are certain other kinds of labs which are accredited. So what are the benefits? Once we say that, okay, the lab is accredited, national, international recognition, as I just told you, public and industry acceptance. Now, if supposing there is a slide, everything is becoming digital. Now, and Dr. Mithilesh, from DigiScan can very well explain that digitalization has connected the words so beautifully that if a slide is here and somebody has to take an opinion from a distance or give an opinion from a distance, it's very easy. But how do you assess that the standard of another lab or the standard or the competence of another person is good enough to give the opinion? That is through this standard. If the competence has been assessed under 15189, we believe that this person is competent enough to give the second opinion. So public and industry acceptance, assurance to the client of good lab practice. It provides a global equivalence, very, very important. Globally, you are at par with other labs. It provides comparability in measurements. Decision makers can rely on the test results. For doctors also, for patients also. Now they don't understand, which lab is good, which lab is bad. So this is like a stamping. As when you go and buy some electronic equipment, you look for a ISI mark, isn't it? So same way, once people understand what is NABL, they look for an NABL mark. And these days, for getting any panel, for getting any bulk work, or for getting any research projects, it's very important that you are accredited by NABL. It improves staff motivation. The people working in the lab also get confidence that whatever they are doing is under a protocol. It ensures better support in the event of legal challenge. Again, very important. It saves money by getting it right at the first time. So, on the whole, as a doctor working in the accredited lab, it raises your confidence in your own reporting. So, you can be very sure that what you are reporting is right. So, now you must be thinking that if, how a person can just judge in a day or 2 days coming for an audit and assessing and saying that yes, this lab is working fine. A very important element of NABL, I'm sure that many of you must be knowing this terminology of proficiency testing or external quality assurance scheme, is that from a source, slides are sent to different laboratories, results are compared, and then those results are sent back to that labs telling where do you stand. Okay, that are you fulfilling the criteria of a good lab or you are an outlier. this is a external quality assurance is a constant process which every lab who undergoes NABL has to follow. That every month or every quarter, whatever may be the schedule, depending upon your scope, you are supposed to follow external quality assurance program. That means comparing your results with the other laboratories. So if your results are comparable to other laboratories and a third body who's running a EQUAS is deciding upon that yes, multiple labs compared, everybody has the same result, that ensures that you are following certain set guidelines and your report is acceptable or competent. Okay, so this EQUAS is a very big confidence to the assessors that this lab is working fine. And this is a prerequisite and a 100% requirement for applying for NABL. So all the labs have to be a part of this proficiency testing program. And of course, the second important thing is when they come and assess you personally. So I'll not go into the detail of EQUAS because EQUAS can be international, national, regional, interlab, and the histopathology EQUAS, Tata is running a histopathology EQUAS, PGI Chandigarh is running a histopathology EQUAS, where multiple slides are sent to multiple labs and the results are compared. So this was external quality control. Same way there is a internal quality control. So you have to keep the internal quality control, especially in a histopathology labs, you have to have certain control slides, which we say that these slides are perfect. And whenever we are making new reagents, we are making new stains, we compare our results with the control slides. So those controls are called as internal controls. So you have to maintain the internal quality standards and you have to be a part of the external quality program as well. So this is laboratory accreditation. NABL is doing multiple works. This is what I told you, the international linkage. So there is a International Laboratory Accreditation Corporation, which has a Asia Pacific branch and a European branch. And Asia Pacific office is in Australia. So India is reporting to Australia for accreditation as an accreditation body. So their head office is in Australia. So same way there is a European, and all these countries are connected to each other through mutual recognition agreements, which are MRAs. So ultimately you can say that all over the world your results become comparable when you become ISO 15189 certified. So this is bilateral mechanism of MRA. Right. So ILAC being the topmost body, their domain is to develop principles and practices of lab accreditation, harmonize the procedures, lay down the criteria, assist in developing new programs, facilitate mutual recognition of the members, reduce technical barriers in trade. This is one of the biggest area which made these ISO programs so popular, that is trade. You know, samples moving from one country to another for research purpose or for opinion, or patients moving from one country to another for opinions. So it's not possible that he gets the whole workup done in one country and then he goes in another country and they don't recognize it and they start from zero. So this bridge has been made with ISO 15189 to make the things easier for trade. So as I told you that NABL itself also has to undergo an assessment or has to undergo ISO standard, which I will just tell you. These are few standards which you should be very well aware of. 17,000, which is conformity assessment or vocabulary and general principles. 17025 is a standard for competence of calibration laboratories. You know that you, in the histopathology, you are using multiple gadgets, right? You are using centrifuges, you are using your staining machines, you are using your microscopes. So all these machines have to be calibrated from the laboratories, which are in turn accredited by 17025. And 15189, of course, you know, is for medical laboratories. 17043 is the standard which EQUAS bodies have to follow. As I just told you that there is an external quality assurance program, they have to follow 17043. So when you participate in a EQUAS program, just ensure that that is accredited by 17043. And 17011 is the ISO, which is being followed by NABL itself. So NABL also has to follow a standard to be a part of the MRA or to be under Asia Pacific accreditation program. So these few standards you should be just familiar with, because when you go for accreditation, you will get in touch with these people. So this was what I just tried to tell you, how globally we are connected through 15189 to all the clinical laboratories all over the world, and what is the importance of it. So now you understand that once you are accredited means you are acceptable all across the world. So ISO 15189 2012 medical laboratories, standard for medical laboratories, particular requirement for quality and competence. Competence is very important. That is why it becomes specific for the clinical labs. So what are the components of it? If you people see this diagram, so what does it depict? This diagram is showing a patient. Doctor has written a prescription. Sample is taken. So sample can be blood sample can be a histo sample, it can be a surgical intervention, and the sample is then moved to the lab. From the lab, data is generated, processing is done, and that data then goes to the surgeon or physician, back to him, and then he puts the treatment. Okay, the data is first interpreted by the lab doctor, who can be a pathologist or biochemist or a particular qualified doctor, and then this data goes to the surgeon or clinician, and then he does the treatment. So if we divide this cycle into three parts, it is pre-analytical, analytical, post-analytical. So this is very, very important to understand that as a pathologist or as a people who are setting up the lab, it's not only the analytical part which is important for us, it is pre-analytical and post-analytical is also our responsibility. So standard has a very big part of pre and post-analytical guidelines. And as the automation is happening, we are seeing statistically the pre-analytical part, the error rate is increasing, because as you all know that samples are moving from collection centers, from periphery to the main centers, from main to further, the referral labs. So a lot of chance of error happens in the pre-analytical area. Sample is not taken properly, sample is not stored properly, it is not put into the formalin properly, or you can say the labeling is not done, samples get exchanged. So a lot happens in the pre-analytical part. Same way, after generating the report, it has reached the right person. The right person is able to interpret. The right person is able to use that report for the benefit of the patient. That also becomes a responsibility of the lab. So you have to train your people starting from the collection of the sample till the delivery of the report, right? So as I was telling you, the scope, there is another document. See, one thing is NABL standard, or as I told you, ISO 15189. Okay. So this ISO 15189 is a standard which is a international document, right? Now that international document is a very general document that the sample has to be reaching the lab within a particular time frame. The sample has to be transported in a particular manner. The sample has to be received in a proper atmosphere. So these are general guidelines. But when it goes to every country has its own documents, okay, to make it specific. So we call those documents as specific criteria documents. For example, the 15189 says that histopathology samples should be, or samples as well as blocks or as well as the report should be stored for a specified time. Okay. Now what is that specified time? That will be given in the local document. So same way, NABL has a document called as 112, which is available freely on the NABL website. You can download it anytime. Even if you go to Google and you fill in NABL 112, you can download that document directly, and that document has a complete specific requirement specialty wise for each specialty. So if you go and see for histopathology, it would be written that blocks and reports of histo should be stored for 10 years. Slides for cytology should be stored for 5 years, right? So this becomes an Indian specification. So NABL 112 document is an Indian document. 15189 document is an international document. So from the international, Indian document has been derived for those specifications. Okay, so when you are implementing the standard, you have to read both the documents, standard as well as 112. So in 112, the scope has been classified into these 8 categories: clinical biochemistry, clinical pathology. Clinical pathology means all your fluids, urine, stool, they will come in clinical pathology. Hematology and immunology, microbiology and serology, histopathology, cytopathology. So they have been taken as 2 separate disciplines: histopathology, cytopathology, then genetics, and then nuclear medicine, right? So if you put the lab investigations, they have to fit in into one of these specialities. Now, coming to what exactly this ISO 1518 standard says, or what are these clauses, or what are these guidelines, so I'll just touch upon briefly, because going into detail means it is a training for practically 4 days. We can talk about, what are the details of every clause and how they have to be implemented and what is their importance. So I'll not be going into that. So I just want to touch upon that there are, as I told you in the beginning, that it has 2 areas: management requirements and it has technical requirements. So management requirements, there are 15 subclauses. Technical requirements, there are 10 subclauses. So what are these subclauses? So if you see management, they are very, very general. So if we see 4.1, it says organization and management requirement. So what does it mean? What is your organization? Is it an independent lab? Is it a hospital lab? Is it a medical college lab? Who is your management? Who is your lab director? Who is your quality manager? Who is the top management? Who is a decision maker for that laboratory? So that becomes the first clause. Then if you move forward, quality management system. Okay. So quality management system means what kind of documentation is required for implementing the QMS. So documentation means, which in detail when you sort of think of applying for NABL, You will have to understand what is a quality manual, what is a sample collection manual, what is a SOP manual. So everything in the quality management system has to be documented beforehand. You have to first sort of pledge that this is what I will be doing in my lab. This is the standard operating procedure for doing the histopathology test of a specific tissue. Okay, this is how I will receive in the lab. This is how I will cut or I will do the grossing. This is how after grossing it will be processed. This is how the reporting will be happen. So for everything there is a SOP. There is a standard operating procedure. So compiling all kinds of SOPs, compiling all kinds of collection methods, compiling the safety measures which you have to take in the lab, all the things compiled make quality management system. So clause 2 describes all those documents. When you go to clause 3, document control, then those documents you have to ensure that who writes that document, who is the person who will approve that document, who's the person who can do any kind of amendment, and how that documents have to be stored, saved in soft copy or hard copy, whose property would be what, who will be the responsible person handling those documents. Okay, so that whole control system is described in 4.3. Now if you go to 4.4, which is service agreements, which means how you will deal with your clients. So this talks about agreements with the clients, which may be a verbal agreement, which may be a written agreement. 4.5 explains examination by referral labs, means there might be certain things, for example, a histopathology lab. So you are doing only histopathology, you are not doing immunohistochemistry, and you are outsourcing your immunohistochemistry to another lab. How will you deal with the lab? What kind of agreement will you have? What all are you outsourcing? How are you outsourcing? That is described in this clause. 4.6 is about the external services and supplies, means your vendor dealing or your purchases. How will you take the supply of your material or machines? Both the things will be covered in 4.6. 4.7 advisory services. So every lab has to have qualified people who can give advice to the patient or to the referring doctor. If referring doctor wants to ask that, okay, for this particular specimen, I want to go in for IHC. What IHC should I go in for? What panels do you have? What panels are you suggesting? So there should be capable people to advise about the lab. 4.8 is resolution of complaints, which you understand from the name that there has to be a system of receiving the complaints, resolving the complaints, analyzing the complaints, and then ensuring that they don't happen again and again. So taking corrective actions, taking preventive actions, and handling the complaints. Next is identification of NCs or non-conformances. So as I told you that there are certain set guidelines which you are supposed to follow. If you are not following a standard guideline, you are deviating from it, how will you identify that yes, I am deviating, and how will you take action to correct those deviations? Corrective actions, of course, if you have deviated or you have complaints or you have problems, how will you take actions? How will you take preventive actions so that problems don't happen? How will you do certain things for continuous improvement? For example, certain trainings, certain CME attendance, certain classes. How will you ensure that? Then comes control of records. Now, whenever a lab is working, okay, it is generating certain data. For example, your reports. For example, every day when you are documenting at what time you started the machine. For example, any calibration you have done. For example, any maintenance done on the machine. All these will generate data. Okay. All those things are what? Records. So if you see clause number 4.3 and if you see clause number 4.13, so document and records. Document is instructions, SOPs given to the lab, and records are generated by the lab and evidence of what you have done in the lab. Okay, so both these things have to be controlled, and they are described in these two clauses, the input to the lab and the output of the lab. Then comes internal audit, 4.40. Internal audit is how time to time, as per NABL requirement, once in a year at least, you would be auditing your own lab and you will be seeing where I am not conforming to the standard guidelines. So that is called internal audit. And when NABL comes, it is external audit. Then comes management review. So again, after every audit, once in a year, your higher management has to review everything, or they have to take a meeting where everything, what happened throughout the year, how many complaints happened, what new equipment was bought, how many audits have been done, how the documents are being maintained, whether the manpower is adequate or not, whether the machinery is adequate or not. So all these things are looked into in the management. Okay, so this is, if you see, very general things which can apply to any kind of lab or any kind of industry when we say it is management clauses. Okay, now if you come to technical clauses, so technical clauses are 10 and they are very specific to the specific laboratory. Now if we go by the first clause, 5.1, personnel. Okay, so personnel, it will cover what should be the qualification of your people. If it is a histopathology lab, so in the histopathology lab, the technicians should have a particular specific qualification. The doctor who is reporting should have a particular qualification, right? So how they have to be appointed, how they have to be given a specific role, how their competence has to be checked time to time, how their competence has to be upgraded time to time, whether they are attending conferences or updates or not, everything will come under personnel, how to handle people in the laboratory. Then second clause talks about accommodation and environment. What does it mean? That what should be the infrastructure of the lab? What should be the environment in the lab? How much light is required, whether shelves are required, or you have benchtop machines, you have floor machines, what kind of setup is required for your lab and how you will take the safety precautions. 5.3 talks about equipment, reagents, consumables. Okay, so how the equipment has to be installed, how will you handle, how will you calibrate, maintaining that equipment, how reagents will be accepted, how inventory has to be controlled. So all will come under 5.3. So your equipment, calibration, handling, maintenance. Then comes pre-examination process. As I told you earlier in that cycle that it is pre-analytical, analytical, post-analytical. So pre-analytical means how the sample collection has to happen. So starting from taking the tissue, putting it in a formalin, what kind of a bottle, how much percentage of formalin, who will bring it, who will label it, what label, ID of that patient, name of that patient, particulars of that patient, male, age, everything has to be put in the form of a SOP which makes sample collection manual. Then 5.5 talks about examination process, where you will write the whole SOP, how the sample is processed in the lab. Once you have received, now what do? Okay, you gross it, you make blocks, then you cut blocks, then you make slides. How do you ensure at every step the quality is taken care of? How do you follow the processes? They have to be written. Then comes ensuring the quality, as I told you earlier also, the internal quality control, external quality control. So these two are the backbones of quality. So this is the most important clause, how you have to control your quality day to day and how you have to compare your results intermittently with other labs, right? So if you are doing only internal control and you are saying that no, my lab is very good, whatever I am doing is perfect, how will anybody believe? The only belief comes when your report goes to 10 other labs and everybody says the same thing. Then we say, okay, this is externally compared and this lab is a quality laboratory. Then comes 5.7, which is a post-examination process, that after the result is generated, how will you report, how the doctor looks at or makes the report and delivers it. Waste disposal, again a very important chapter. Sample storage, you all know that in histopathology, storage of samples, storage of blocks, storage of slides is again very, very important. 5.8 is report content. So how will you create a report? What all information should be there on the report? 5.9 is release the report. Okay, how the report will reach the clinician. Whether it is an urgent report, it is a critical report, it is a provisional report, it is a revised report, all these elements will come under releasing. And third, and the last is 5.10, which is LIS, Lab Information System, or the softwares which you are using for reporting purposes. All that, whether you are using softwares or not doesn't matter, but whatever information or how you are compiling your report, how you are ensuring the confidentiality of every patient's report, okay, where you are storing the reports. If a patient comes after 5 years to take his reports and block, are you able to produce that? So that whole information system has to be in a proper manner. It has to be controlled. So these were the 10 clauses which are technical. So I hope this is in a quick succession. I hope that at least the overview of the whole thing, you have understood that what are these management or technical clauses. The details, I understand that in a short while or in one topic, it is not possible to sort of have the whole knowledge of it. It will take its own time when you think of applying, then you will understand that. So these are few other documents which are important, which are NABL documents. 112 I told you is a specific criteria. Then NABL 217 is checklist. When you're auditing your lab, what checklist should you follow? 160 is how to write a quality manual. 153 is how to apply for NABL. And then 100 and 130 are more important. Once you get the NABL, how to maintain it, how to follow the guidelines given by the NABL to maintain your NABL. Okay, so once you think of applying, then you will have to download all these documents from NABL site and you have to go through it. Size of the lab I told you earlier also is very important. So if we come to the conclusion, certain things which you need to start with when you think of applying for NABL is, look at your premises. My space is good enough. My rooms are okay. I have a separate place for grossing. I have a separate place for rest of the procedures. There is a reporting room. Grossing has formalin. Am I assuring that, formalin is checked day to day? What are the procedures to keep the, you can say, concentration of the formalin in a room to a proper level where it is not harming your health? So all these things are very, very important once we talk about the premises. Then second thing, of course, the equipment. So equipment also, the detail depending upon the size of the lab, depending upon automation you want to do. So all these things will depend upon how then comes the calibration part, and then comes how you have to retain your samples, document everything, and then pre and post analytical precautions which you have to take. So I can see one or two questions. I will just take those once I finish. So 2-3 things which are very important, as you all know: the retention, histopathology reports, blogs, slides for 10 years, cytopathology for 5 years, cytogenetics, fish images for 10 years. So all these guidelines you are supposed to follow. So if we come to the last steps, now the application has become online. Okay. So you have to go to NABL site, go to the application site, apply online. It's very simple. They will keep guiding you, and they will also appoint a guide for you, whom you can call. You can find out, how I have to fill the application, what are particulars are required. Then there comes, after your application is completed, you have put in the information of your scope, you have put in the information of your manpower, information about your equipment, information about your internal quality results, about your external quality results, about your internal audit findings. So these are 5-6 things which stepwise you have to put in, and then your application is accepted. Then there comes a pre-assessment, which has become optional now. Whether you want a audit before the final audit or you don't want. So labs ask you, the NABL asks you, you want it or you don't want it. Then comes the final assessment, where a team comes and assesses you. And then every year there is a surveillance, and every 2 years there is a reassessment. Once a year surveillance, and every 2 years there is a reassessment. So initial few audits are personal when teams come and audit you, and after third audit it becomes a desktop that you have to send the documents to NABL and they make the assessment. Now these days, though, for past 7 months because of COVID, it is all online assessment which is going on. These are few batches which we train, and this was just the overview of what is NABL, why it is important, and how we have to go about it. So if you have any questions, you can let me know. There is one question. Thank you for the good presentation. What is your opinion on becoming an ISO consultant? Becoming ISO consultant, if anybody wants, it is very important that you have the complete knowledge of the ISO standard. You have to go through certain trainings, and then once you have a complete knowledge as well as the practical experience to implement the quality system, you can always apply for being a consultant. There is official site with Quality Council of India where you can apply for becoming a consultant. And as it is also, if you are competent, you can help other people and you can become ISO consultant. But if you want to become an ISO assessor with NABL, then NABL has a specified 5 days training with an exam. If you clear that, then you can be a NABL auditor. There's another question by Jyoti Sharma. Hi ma'am, thanks for a wonderful lecture. Just want to ask, as an oral pathologist, what kind of a lab we can run? Means, can we do biochemistry, hematology along with the histopathology? See, when you say oral pathologist, it will depend. If supposing you are MDS, currently there is a little question mark about, that whether MDS people can become assessors or not, or MDS people can become the authorized signatory or not. But I feel that once you have a proper qualification and you show the competence, the rules have changed from 2018. 2018 Ministry of Health and Family Welfare guidelines have talked about, the types of labs and the authorized signatory for those labs, where NABL has now removed those specification, and they just say the document, if you go and read 112, the document says that you can be signatory by showing your competence to the assessor, right? So if you are competent enough to report, the histopathology, then it is discretion of the assessor whether they can assign you the authorizing signatory responsibility or not. Okay. Now, what you have asked is whether they can sign biochemistry, hematology or not. This will depend upon because I'm not very sure that as an MDS, whether you do in your practicals biochemistry, hematology or not. But if you are doing in your course hematology and biochemistry also, and you can show that competence to the assessor, I'm sure that you will be allowed to sign that also. For example, now in COVID testing, officially, if you see, COVID testing has to be done by, it's a microbiology part. So only microbiologists should be allowed, but no. What NABL is doing, they are assessing the competence that if you can report a molecular biology report, or if you can report a COVID report, you can interpret. Pathologists, biochemists, they are also allowed to sign the reports. So a lot has changed in NABL now. More than qualification, the stress is on the competency. Okay, so when assessment happens, if you're competent enough to show that you can do these reportings, they allow you. Any other question?
No questions, Jatinder? No more questions?
Okay. So I don't see any other questions in the chat.
Yeah.
Yeah. So if there is no other question, then we can.
And we can close the session.
We can close the session.
Okay. Thank you. Thank you so much.
All right. Thank you.
Okay.